Lungs versus heart, which one is the most overworked? A medical joke. The lungs speak first. Do you know how much air I breathe in a day? More than 20,000 breaths. And I have to filter dust, PM 2.5, second-hand smoke, e-cigarettes. And when I cough, everyone says, "Look, your lungs are unhealthy."
The heart sneers. Heh. I beat 100,000 times a day. No days off, no overtime pay. You cough a couple of times and the whole family gets worried. I have a blockage in its front page news.
The lungs retort. That's because you're always causing trouble. High blood pressure, staying up late, stress, overeating. It's all your own doing.
The heart counters. Do you think you're so clean? Smoking, smog, sedentary lifestyle, chest tightness, lack of exercise. I'm just tired. You're being poisoned every day.
The lungs sigh. Anyway, it's always our fault when humans have health problems.
The heart nods. That's right. Humans summarize it in one sentence. My health is bad. But I never reflect on my lifestyle.
The doctor's insightful summary. Most heart problems don't happen suddenly, but are the result of years of accumulation. Long-term sedentary lifestyle. High salt, high sugar diet. Sleep disorders. Chronic stress. Smoking and drinking. Metabolic syndrome, insulin resistance. The heart is merely the organ that suffers the consequences, not the culprit. Most lung problems also don't happen suddenly. This is a consensus conclusion in respiratory medicine. Common lung diseases are almost all long-term cumulative damage. Chronic obstructive pulmonary disease, COPD. Emphysema. Pulmonary fibrosis. Chronic bronchitis. Occupational lung disease. Lung function decline related to air pollution. Reduced ventilation efficiency and reduced lung function reserve related to sedentary lifestyle, long-term shallow and rapid breathing, and reduced diaphragm activity. What is truly sudden is usually just that you suddenly notice the symptoms. Not that the disease suddenly appeared.
Both the lungs and the heart speak in unison. Doctor, overtime work due to chronic diseases, acute exacerbations, and repeated follow-up visits. Patient, continuing to stay up late because lifestyle habits haven't changed, leading to constant disease relapses. Classic summary, in cardiopulmonary medicine, this is a classic vicious cycle. Staying up late leads to sympathetic nervous system activation, chronic inflammation, elevated blood pressure, increased heart rate, and decreased immune function. Both the heart and lungs are dragged down. The organs are working overtime, while the lifestyle is self-destructive.